Whether you have a surgical scar, an acne scar, or something in between, you're probably wondering what you can actually do to help it heal and fade. Today, I'm giving you my complete scar treatment guide. If you're new here, welcome. I'm Dr. Eric Berg, and I created this channel to help you take better care of your skin. I can hardly believe I've had a YouTube channel for this long without making a dedicated video on scars. Scars make up a huge part of what I see in my clinical practice, and I also create them anytime I perform a biopsy or surgery. I want to share all my best tips and tricks to help your skin heal optimally and fade those marks as fast as possible. I completely understand the deep emotional toll that scars can take, and as a doctor, I want to do everything in my power to support you through that process. You're going to learn a ton today, so if you're looking for more guidance like this, make sure to give this video a thumbs up and subscribe to the channel. Before you can figure out the best way to treat your scar, you first need to know what type of mark you're actually dealing with. First up is post-inflammatory hyperpigmentation, or PIH. This shows up as flat, brown discoloration in an area where your skin previously experienced inflammation, like an old acne mark, a bug bite, or minor trauma. The key thing to remember with PIH is that your skin texture remains completely smooth and normal. Because there is no texture change, it isn't actually a true scar, it's just pigment. In that exact same vein, we have post-inflammatory erythema, or PIE. Instead of a brown mark, PIE leaves a flat red patch of discoloration where inflammation occurred. This is especially common after an acne breakout on fair skin tones. Just like PIH, the surface remains completely flat, meaning it isn't considered a true scar either. After we go over the actual scar types, I'll still share tips on how to fade both PIH and PIE. But it's worth noting right now that with consistent sun protection and time, these dark and red marks will naturally fade away on their own without major intervention. Now, a true scar always involves a change in texture. It will either be raised above or sunken below the surrounding skin. That textural change is the defining feature. One of the most common true scars I treat in my clinic is a hypertrophic scar. This happens when a scar slightly overgrows the original boundary of the injury. They tend to be raised, firm, and sometimes red or brown, and they frequently develop after surgery, deep wounds, or burns. While a hypertrophic scar is slightly enlarged, it is distinct from a keloid. A keloid is a type of scar that expands way beyond the original borders of the wound. Keloids have a very strong genetic component, and distinguishing between a keloid and a hypertrophic scar is critical because we treat them differently. On the flip side of raised or keloid scars, you have sunken marks, which we call atrophic scars. This occurs when the underlying tissue beneath the skin surface is lost or damaged, causing the scar to dip inward. While you can certainly develop an atrophic scar from surgery, they are far more common after acne breakouts and stretch marks. So, what actually determines how your scar heals? Whenever I'm in the operating room, I tell my patients the exact same thing before every procedure. Your final scar is determined by three things: me and my surgical technique, you and how well you care for it, and your genetics, which neither of us can control. I'll do my part, you do yours. And while scarless surgery simply doesn't exist, doing our best on both ends gives us the ultimate chance at a subtle result. Honestly, I should probably start saying there are 4 factors, because alongside technique, aftercare, and genetics, the location on your body plays a huge role. Certain areas, like the chest, shoulders, and back, are much more prone to hypertrophic scars simply because the skin there experiences higher tension. When a healing wound is under constant tension, the body naturally lays down extra scar tissue to fortify the area. However, there are techniques I use during surgery to relieve that tension. When removing something like a skin cancer, I carefully orient the incision to align with your skin's natural tension lines so the surrounding skin doesn't pull against it. We also place multiple layers of sutures. Deeper, long-lasting sutures dissolve over roughly 6 months, holding the underlying fat and deep dermis together so that when I sew the top layer, there's zero tension on the surface. Of course, the suture technique, thread size, and timing of removal are equally critical. Leave stitches in too long and you risk that dreaded railroad track pattern. Because of this, I generally remove facial stitches after 5 to 7 days and body stitches around the 2-week mark. As for taking care of your wound while stitches are still in, your main job is to keep tension off the area. Avoid intense activities during this crucial initial healing phase so the wound doesn't pop open, and keep it meticulously clean. An infection will almost certainly compromise your final scar result. I always encourage my patients to keep their healing wounds moist with a dab of Vaseline and covered with a clean bandage until suture removal, though you should always follow your specific surgeon's exact protocol. This exact same care principle applies even if you haven't had surgery and are just dealing with a standard scrape or burn. Clean it thoroughly every day, apply an ointment, and keep a Band-Aid on it until fresh skin forms over the wound. Once your stitches or staples are removed, continuing to minimize tension on the scar is vital. I often recommend using small butterfly bandages to support the area for another couple of weeks. Once the skin has fully re-epithelialized, meaning a brand new layer of delicate skin has covered the cut, scrape, burn, or incision, you can officially start using tools like silicone and sun protection to optimize healing long-term. Notice how I didn't mention vitamin E. Vitamin E really has no place in modern scar care. It's largely an old wives' tale with no scientific evidence backing its efficacy. No matter what type of scar you have, or if you're just dealing with discoloration like PIH or PIE, the single most important thing you can do is protect it from the sun. That means wearing sun protective clothing, placing an opaque bandage over it, or applying a thick layer of sunscreen every single time you leave the house, consistently for a full year. Sun protection is truly the absolute #1 factor in scar care. If you only have post-inflammatory hyperpigmentation or erythema, sun protection is also the foundation of restoring your skin. To speed up the process, you can introduce active ingredients like vitamin C, niacinamide, azelaic acid, or retinoids, which accelerate cell turnover and block excess pigment production. But keep in mind, even if you did absolutely nothing else for PIH or PIE, besides protecting it from the sun and giving it time, it would completely fade on its own. For stubborn hyperpigmentation, a dermatologist can prescribe treatments like hydroquinone to directly halt excess pigment production and clear the mark. For persistent redness, in-office vascular lasers like the V-beam can dramatically speed up fading. When it comes to traumatic injuries or fresh surgical scars, my strongest advice is to start early. Do not wait for a scar to fully mature before taking action. While you should always defer to your surgeon, most are comfortable with you starting at home and in-office treatments 1 to 2 weeks after stitch removal. In my own practice, I sometimes laser a patient's scar the very same day their stitches come out. The wound simply needs to be completely closed and healed before initiating treatment. Even if you never step foot in a dermatology office for professional treatments, topical silicone is an incredible tool to use at home. Aside from sun protection, silicone has the most solid scientific data backing its effectiveness, and it comes in several convenient forms. Silicone gel sheets are fantastic for larger scars if you don't mind wearing adhesive on your skin. Wearing a silicone sheet for 23 hours a day over the course of 6 months can yield incredible improvements. Plus, research shows silicone can even benefit older established scars. So if you have a mark from years ago, trying silicone is definitely not a waste of time. I love sheets because you can essentially set it and forget it. However, if your scar is on your face or you dislike adhesives, scar gels or scar sticks are phenomenal alternatives. I will make sure to link some of my personal favorites across all these categories in the description box below. The ultimate key with silicone and any scar therapy is absolute consistency. If you choose silicone, you need to commit to applying it every single day. Gels and sticks should be applied twice daily. When using a stick, gently massage the area in tiny circles for about 60 seconds. This deposits an adequate layer of silicone to protect the skin and encourage healthy tissue regeneration. You'll often hear scar massage recommended as well. While we don't have as much formal scientific data on massage, many surgeons instruct their patients to practice it post-procedure. Performing firm, circular massage motions over the scar a couple of times a day can help prevent excessive scar tissue buildup and break down dense collagen fibers that have already formed. I also want to cover the powerful in-office treatments available, as I perform these frequently. If you have a thick or raised scar, whether hypertrophic or a true keloid, one of our primary interventions is a targeted steroid injection. We often combine that steroid with a chemotherapeutic agent called 5-fluorouracil, which further aids in breaking down dense scar tissue. While injections won't make a scar vanish entirely, they reliably flatten the tissue and make it softer. If your scar is intensely itchy, these injections offer tremendous relief as well. Injections are typically performed as a series, with patients returning every 4 to 6 weeks. We evaluate progress at every visit, and if the scar stops responding or plateaus, we stop the injections. This protocol works well for both hypertrophic and keloid scars, though keloids can be notoriously stubborn. If someone has a severe, disfiguring, painful, or expanding keloid that fails to respond to injections, we refer them out for specialized radiation therapy. Beyond injections, advanced lasers can dramatically transform scar texture and tone. If a scar is red, I use a V-beam laser to target the redness and fade the color. If a scar remains raised and resistant to injections, I utilize a CO2 laser or Fraxel laser to smooth and flatten the surface. Our goal with professional scar therapy is always significant aesthetic improvement. We can never erase a scar completely, but we can often make it look drastically better. Just like injections, laser treatments are typically spaced 4 to 6 weeks apart, and we frequently combine multiple modalities in a single session. You might have noticed I didn't dive deep into acne scars today outside of PIH and PIE. That's because I have an entire dedicated video covering acne scars in full detail that you should definitely watch next. And while fresh scars respond fastest, if you have an older scar that bothers you, it is still 100% worth booking a consultation. Injections and laser therapy can still deliver incredible value for mature scars. No matter your unique situation, there is almost always something we can do to help your skin look its best. If you found this video helpful, please share it so others can benefit from these tips. Leave any questions you have about scars in the comments below, along with topics you'd love to see in future videos. Thank you so much for spending your time with me today. Don't forget to like and subscribe to the channel, and I will see you in the next video.